Hello everyone, my name is Hazel Lavalle and I'm presenting my Learning Health portfolio.
Waking up tired, feeling sleepy in the daytime, waking up several times in the night, and taking a long time before falling asleep characterizes insomnia in the elderly.
The lack of sleep can be acute where it occurs for a few nights in 1 or 2 weeks, or it can be chronic where it occurs 3 or more nights in a week for more than a month. Sleep or difficulty falling asleep at least 3 nights per week and last at least 90 days. Insomnia affects 16 to 40% of general public in developed Western nations.
1 in 3 adults do not get adequate sleep in the USA.
It is estimated that 30 to 40% of all American adults have at one time developed insomnia for the last 1 year. Statistics about the prevalence of insomnia in the elderly in LA County are unavailable. However, based on national statistics, the prevalence lies between 12% and 20%.
In the state of California, the elderly population is projected to increase 3-fold compared to the total population. Between 2010 and 2060, the elderly population is predicted to increase 171.3%.
The disease is most common with old age because as a person ages, the more the likelihood they will change their sleeping pattern due to their schedule. When people get older, they become less active, and this may make them sleep during the day, which interferes with sleeping at night. The health of most people changes with old age. Old people are prone to health conditions such as arthritis, depression, and back problems, which keep them awake at night. They also take more medications whose side effects can cause insomnia and have several hormonal changes that occur as they become older. All these factors predispose older people to insomnia. People aged over 60 years old are more likely to get the disease because of their declining health and changes in their sleeping patterns.
Insomnia is usually misdiagnosed due to the misconception that it is a normal part of health.
Gender is a risk factor, and elderly women are at an increased risk as they have several hormonal changes that occur during menopause that disrupt their sleeping pattern. Lack of sleep also predisposes one to chronic diseases and conditions like obesity, heart disease, and type 2 diabetes mellitus. Mental health disorder is another risk factor in this subpopulation because the elderly suffer from depression, abandonment, abuse, loneliness, and stress, which might predispose them to insomnia. For instance, evidence shows that elderly persons with insomnia are 23% more likely to develop depression symptoms. Irregular work schedule, where sometimes one travels at night, can disrupt normal sleep-wake cycle leading to insomnia.
More than 50% of older adults have at least one sleep complaint. The burden of sleep-related disorder will increase in the future. It is estimated that 100 million people would have sleeping problems by 2050. Chronic insomnia reduces the quality of life among elderly adults, and 60% of these population uses prescription sleep aids and care services.
The Imogen King's theory of goal attainment is applicable in the management of insomnia. In its application, the first action is doing an assessment of the patient, during which the nurse collects information about the patient's current sleep status, medications being taken, and the duration of the problem, among others. The nurse then uses the patient's perception as the basis for data collection and interpretation. The nurse then collects the patient's history, demographic information, current history of sleep deprivation, past history of sleep deprivation, family history, lifestyle, as well as information on the socioeconomic status of the patient to inform the nursing decision. After making a nursing decision, the nurse plans for an intervention to manage the sleep deprivation problem. The plan could include setting goals, making choices, and agreeing on the means to realize these goals. The nurse's goals could entail acquiring knowledge about preventive measures and treatment and attending to the problem immediately. The patient goals would include acquiring knowledge about sleep deprivation, improving quality of sleep and quality of life, and increased sleep duration. The last step in applying the theory of goal attainment entails an evaluation that involves finding out if the set of goals were achieved. LA County has an estimated population of 5.2 million. The Los Angeles healthcare system has numerous big healthcare organizations, including community healthcare facilities that provide healthcare services to the citizens. LA County is committed to ensure everyone has access to healthcare services. Medications and behavioral therapy strategies are available in LA County and provided by both private and public practitioners.
Majority of the available pharmacologic interventions for managing insomnia in the elderly population are associated with burdensome side effects. Behavioral therapy treatment strategies have no side effects but are cost prohibitive.
One study showed that it would cost $40,000 and $60,000 for a 90 and 95% probability of gaining an additional quality adjusted life year, respectively, by combining cognitive behavioral therapy for insomnia and drugs, where one quality adjusted life year equals to 1 year in perfect health. UCLA has a sleep disorder program offered in its sleep disorders clinic. The program provides diagnosis and treatment services for patients with sleeping disorders and conditions, as well as does research about sleeping disorders. To individuals with insomnia, the UCLA Sleep Disorders Center provide behavioral and medical interventions to alleviate the condition. Insomnia in the elderly is a costly health condition. However, it can be effectively managed through medications and behavioral therapy if diagnosed early. Persons suffering from insomnia in LA County can visit the UCLA Sleep Disorders Clinic to seek help, and these efforts can reduce the incidences of insomnia. Thank you for listening.